Hey, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. This show is for you, by you, and about you. It's all about health, how to take care of yourself, what we need to do for whatever ailment we have. I'm here alone tonight, no guest, and so I'm live, so you can give me a call, 407-1111. We'll talk about anything you have on your heart and your mind. We want to thank WHIG. This is a community-sponsored program by them. They are passionate about helping anybody in the community with a variety of things, as you can tell by their programming. They are all about our community, and I'm all about our community, so I just think that that's wonderful. So I'm going to talk about, we talked a couple weeks ago, I had Dr. Manikin on, and we talked about cancers and the great things that they're doing over at the Nash Cancer area for that. They treat cancer, they do radiation, they do IV infusions, they do cancer trials to, try and get a cure and get this to where we don't have to be so worried about cancer anymore. And so I thought I'd kind of carry on this theme. I was going to do this last week, but my son ended up, he was supposed to come for the weekend from Asheville, and he ended up coming Wednesday and Thursday and leaving Friday. So I took last week off so I could spend time with my son and my family. We ended up having our Easter dinner last Wednesday night, and it was lovely to have all my children there and my grandchildren. We don't get to see everybody all together a lot, so it was really nice, and I really appreciated it. So we're going to talk about colon cancer tonight. It is the third largest cause of death in the United States is colon cancer. And really, there is no reason for it. If we get screened at age 50 or earlier, if something indicates that, and we keep up with, eating well, exercising, don't smoke, the things that we need to do anyway just to take care of ourselves, that number should drop. It's astonishing to me that it's something that can be caught so early and can be treated pretty easily in terms of that, in terms of cancer of any kind. And there's just no reason. I don't know why people don't go. People are afraid to have the colonoscopy. The procedure itself is a piece of cake. You don't even know what's happening. The prep the day before, however, that's a little bit unnerving. But, it's well worth not getting cancer in your colon and having part of your colon cut out, or having a bag put on your side to eliminate yourself because you had to, remove the part that God gave us to do the elimination. So I'm really going to harp on this tonight, I think, the colon cancer and why we don't. And if any of you haven't done a colonoscopy or don't want to, or if you're afraid or whatever the issue is, give us a call so we can discuss it. I promise I won't lecture you. But I'm really interested to know what motivates people or unmotivates people, for that matter, when it comes to that. Now, there is a fairly new test. I guess it's been out maybe 5 years or so. Time goes by so fast that I can't keep track. But it's called Cologuard, and it's intended to screen people 45 and older who are at an average risk for colon cancer, and we all are at risk. We don't know, who gets it and why, but it happens. And this Cologuard, you test your stool kind of like the same way. I'm sure you've all had to do what we call a Hemoccult or a stool card, where you get a little kit, and you get a little card, and you get a stick, and you obtain a sample of your stool and put it on this card for, I think it's 3 different days, 3 different samples, and you bring that into your doctor for your yearly exam. So it's like that in terms of obtaining the specimen. It is not like that as far as the results. Cologuard can detect DNA. There are certain DNA markers and blood in the stool. So if they come back positive, then you will have to have a colonoscopy. But I think I've only had 1 or 2 positive in all the Cologuards I've done. Excuse me, you know how it is. I go off and eat after work, and then I get sleepy. So, so Cologuard, it's not a replacement for colonoscopy, especially in high-risk patients. But it anywhere from 45 on up. A lot of people, if they're real hesitant to have a colonoscopy, or they're just absolutely flatly refuse, then I will have them do this test, because then if they need the colonoscopy, I've got proof positive. Now, if you've had an adenoma, have inflammatory bowel disease, or certain hereditary syndromes, or personal or family history of colorectal, Cologuard is not probably for you. But the most people can use this. We give you I don't think we give you the kit at our office. If I order a Cologuard for a patient, I think Joyce, one of the people that work in our office, she will contact the company, and the company sends out the kit. They pay the postage, so they send it to you. You obtain your stool. They give you the packaging and the postage for you to send it back. And then the results come to my office. So if you need a colon screen of some sort, if you're afraid, of the procedure of the colonoscopy, or afraid of the prep, talk to your doctor and see if you can do this. It's not the same as having a colonoscopy, but it will really show if there's a high possibility that you have colon cancer. And then, we can move on to the next step if we had to. So let's just back up a little bit. So what is colon cancer? Well, it's a type of cancer that begins in the large intestine, or the colon. The colon is the final part of your digestive tract. So you have the small bowel, the transverse bowel, and the large bowel, or colon. And we've got, I can't remember how many feet, I should have looked this up, of a bowel in our belly. It kind of goes like this. So it's not just like a straight tube from your esophagus through your belly down through into your anus. It goes all over the abdomen there, and there's various parts of the colon that do particular parts. Your food is, acid spills into your food when it empties into your stomach, and that breaks down the food, and then it goes through the colon, and various parts of the colon obtain the nutrients in the food that we need. And then what isn't obtained through the passage through all the colon is eliminated. That we hope to do that every day or every other day anyway. And so colon cancer typically affects older folks. We start screening at age 50. Earlier, if you have a family history of it, if daddy died from it, then those numbers change. But for the ordinary Joe Blow, we start screening about age 50. And cancer can happen at any age, and it usually begins as a small, non-cancerous, benign clump of cells called polyps that form on the inside of the colon. And anybody who's had a colonoscopy has probably had polyps and have them removed. I've had polyps in my colon and had them removed. I just had a colonoscopy, I don't know, a couple weeks ago now. Because even though I'm old and can screen out of some of these things as we age, I'm going to live for a long time, and I've got a lot of living to do and a lot of working to do and a lot of TV shows to do, and so I want to be as healthy as I can. So polyps, they can form into cancer, and you'll get, if they snare or take a polyp from your colon, they send it off, to the pathologist, and then it's read, and they'll tell you if it's cancerous or not. There's a word called adenoma, which is a precancerous polyp, and that I've had several of those. It's, thank God, has never gone any farther than that. But I have to have a colonoscopy every 3 years now because of that, because they don't want those polyps to have a chance to grow and multiply and divide and turn into a cancer in my colon. So they usually remove those polyps and test them to see where they're at with all of that. Colon cancer, there's many treatments that are available, and we'll go into that in a minute. But what are some of the symptoms of colon cancer? And colon cancer is also called colorectal cancer. And that's a term that combines the colon cancer and the rectal cancer. And normally that starts in the rectum, but not necessarily. So the signs and symptoms of colon cancer include a persistent change in your bowel habits, including diarrhea, constipation, or a change in the consistency of your stool, rectal bleeding or blood in your stool, persistent abdominal discomfort such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness, fatigue, unexplained weight loss. Those are some of the symptoms. And I just want to back up here to rectal bleeding or blood in your stool. A lot of us have hemorrhoids, or we have bright red bleeding from our colon. Scares the pudding out of you, especially if you've got a lot of blood maybe in a hemorrhoid and you look down in the commode after you've had a bowel movement and it's a dark pink or a light pink, and you know that it's blood. Scares you. And it should. I don't want anybody to discount that. But I can tell you, as a general rule, if you have bright red blood, it's normally right at the rectum. It could be a fissure or a little tear in your skin at your rectum. The skin around our rectum is very tender and it's fragile. And if you're constipated and you're passing hard, some stools are hard as rocks if you don't drink enough water and that kind of thing. And it can pass through the rectum and tear your skin a little bit. That can cause bright red bleeding. That can cause a lot of pain. And that is something that you would, go to the doctor for. You can also have bleeding hemorrhoids. A lot of hemorrhoids bleed. A lot of us have hemorrhoids. For the most part, they're painless and they're annoying, but they're not going to hurt you. But but those can fill with blood and then they break open and the bright red blood shows up. And the bright red blood is normally either a hemorrhoid or a fissure. Now you can have internal hemorrhoids and external hemorrhoids, external being on the outside. If I do an exam and look at you, I can see them. Internal are up inside the rectum, and so then I can, as far as my finger will go up, if there's a hemorrhoid there, I can feel it. Sometimes they're higher than that and I can't. But if you have a stool that is a maroon color, kind of a brownish red color, that's a little bit more concerning. And then if you have a black stool, that means you're bleeding somewhere high up, probably like in your stomach area. And it might be because you've got a little gastric ulcer, because the stomach acid has been producing too much in your belly, or you've been taking a lot of nonsteroidal anti-inflammatories, and that can cause an ulcer if you take too many. But if it's black, dark brown, or maroon color, that means that the source of the blood is up higher. And the higher up it goes, the more concerning it is. So that's kind of just a general rule of thumb for blood in your stool, but you always go to the doctor no matter what and let them tell you it's okay or we need to do further intervention. So those are the signs and the symptoms. Unfortunately, many people with colon cancer, you don't experience any of those symptoms in the early stages of the disease. And when the symptoms do come in, that is very likely when the cancer has grown and could be to the point that you're not going to be able to get it all, or you're going to take out so much of your colon that you're going to have a bag hanging off of your abdomen collecting your stool. So if you have any of those symptoms, you need to call your doctor immediately. Even with the bright red blood, which probably isn't as concerning as some, but until we prove otherwise, you need to be to the doctor, and we need to find out exactly where that blood's coming from. All in all, doctors are not sure what causes colon cancers. In general, colon cancer starts when you have healthy cells in the colon that develop changes or mutations in their DNA. A cell's DNA contains a set of instructions that tell a cell what to do. Healthy cells grow and divide in an orderly way to keep your body functioning normally. But when a cell's DNA is damaged, it becomes cancerous. Cells continue to divide, but even when new cells aren't needed. And as cells accumulate, they form a tumor. With time, cancer cells can grow and to invade and destroy the normal tissue nearby it. And cancerous cells can travel to other parts of the body to form deposits there. That's called metastasis. So some of the risk factors for colon cancer: your age. The older we are, the more susceptible we are to the diseases. Our body parts wear out, our immune system isn't as strong, and as we age, we have a higher chance of getting these diseases than when we were in our 20s. But the colon cancer can be at any age, but the majority of cancers are found at age 50. So that's why they've, taken 50 as the marker for getting your first colonoscopy. So when you go to your your physician and you're 50 years old, he's going to say, hey, it's time for a colonoscopy. So anybody that's around that age, just be prepared to hear that. So older age is one of the reasons for colon cancer. And then certain races are more susceptible than others. They have a higher risk. And the African American population, it has a greater risk of colon cancer than other races. they don't know why. I don't know if it's socioeconomic. Is it because they don't have as much money, they don't eat as well, they don't have the money to go to the doctor? I mean, I don't know. I'm just kind of giving some hypothesis here. And then risk factor, if you've had a personal history of colorectal cancer or polyps. So like I told you, I've had polyps, so now I'm at a higher risk for developing colon cancer. And inflammatory conditions in your bowel. There's several different inflammatory diseases of the colon, but I see it's time for our first break. So when we come back, we'll talk about the inflammatory intestinal conditions. So don't go away. We'll be right back after these sponsors. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Welcome back. This is Here's to Your Good Health. We're talking about colon cancer tonight, and I am live, so if you got a question or a comment, does not have to be just on colon cancer, it can be on anything. Give us a call, 407-1111. We were talking about the risk factors for colon cancer, and we talked about older age, the African American race, a personal history of colorectal cancer or polyps. And then we started going into the chronic intestinal, or inflammatory intestinal conditions. And chronic inflammatory diseases of the colon, such as ulcerative colitis, Crohn's disease, can increase your risk factor for colon cancer. And then you can have some inherited syndromes that increase colon cancer risk. Some gene mutations can be passed down from family members and increase your colon cancer risk. The most popular or the most common syndrome is a familial adenomatosis polyposis and a Lynch syndrome. I've never heard of either one of these. Are called hereditary non-polyposis colorectal cancer, but I suppose the GI guys know all about it, so I don't really need to know. I just need to know that I send them there, and then they take care of business for me. Low fiber, high fat diet may be associated with a typical Western diet. You know, we have the worst diet. We're the fattest people. We have all this abundance of all this junk food, fast foods, and honey buns, and all this stuff in packages and boxes. We don't cook fresh, and all that can lead to colon cancer. So, and some say red meats and processed meat. You know, and I've said this before, I try very hard not to eat any processed meat. About the only processed meat I eat is ham, and I'll have that, you know, like we had one for Easter and stuff like that. But I try not to eat that kind of stuff because it's full of chemicals and it's full of salt, both of which we don't need. And then a sedentary lifestyle, you know, they're saying now that the couch potato is the new smoker. We've really worked hard on stopping people from smoking and done a great job. But now they sit on the couch and go and play their games, and I'm the worst. When I get home from work, I sit for about an hour and I play Candy Crush or something. I just need to unwind and let my brain think about nothing. And so, but I try to, you know, put exercise in my diet. I've started 3 days in a row. I'm on a roll now. I've gotten up early and I get on my elliptical before I go to work, because after work there's always something in my way. I just can't get to the gym. So my son gave me an elliptical. I have it out on my screened-in porch, and it's been too cold. That was my excuse for not getting on, but now it's not too cold. So I get up there and do that. But anyway, a sedentary lifestyle. People who are inactive are more likely to develop colon cancer. And so regular physical activity helps prevent that. Diabetes. If you have diabetes or insulin resistance, you have an increased risk for colon cancer. Obesity. They have a higher risk of colon cancer and an increased risk of dying from colon cancer when compared to people of normal weight. Smoking, do I need to even belabor that point anymore? You know, I absolutely hate cigarettes, and I smoked for 10 years. I mean, you know, I'm not a super Pollyanna who didn't do anything, but you know, I did quit, I guess, let's see, probably 40 years ago now. It was in the early 80s that well, it might have been the late 70s that I quit, because my daughter was born in 79. I think I quit in 80. But anyway, smoking, you have an increased risk for any kind of cancer, but colon cancer is certainly in that pot. And then heavy use of alcohol, you know, that doesn't do anybody any good either. And then radiation therapy directed at the abdomen to treat previous cancers puts you at a higher risk of getting colon cancer. So, you know, prevention is what we want to do, and one of the biggest prevention, of course, is a screening at age 50, a colonoscopy at age 50. And so we've already talked about the different screening options. I'm a big proponent of Cologuard. I think that that's a great way to do it. I think it's a better way. I think it's more sensitive and can show us more information than just a regular stool sample. And then, of course, lifestyle changes, you know, eat a variety of fruits, vegetables, and whole grains. They contain vitamins, minerals, fiber, antioxidants, and they all play a role in cancer prevention. And so, you know, choose a variety of fruits and vegetables so you get a good mix of all the vitamins and nutrients that we need. And drink alcohol in moderation. If you choose to drink alcohol, I don't have a problem with people drinking alcohol. You want to have a glass of wine with dinner? Great. I don't have a problem with that. I have a problem with people who drink to excess. So moderation, you know, 1 drink for a woman and 2 for men a day. And to me, that's kind of too much too, like 1 a weekend maybe. Exercise most days of the week and try to get 30 minutes of exercise. And if you've been inactive like me, I've started slow. I started at 4 minutes. Today I did 7 minutes on the elliptical. I mean, my goal is to get to 30, and I could have gone a little bit longer, but I'm just trying to, you know, the first day I did it, I got up the next day, I went to work, and my hips hurt and my knees hurt, and I thought, what the heck? And then I went to bed that night, and my knees just ached, and I went, am I coming down with something? What the heck's going on? And then I realized, oh, I was on the elliptical. So, you know, it's not only just your cardiovascular health that you need to do, and it's good for you to move. And if you've got arthritis, movement is the first treatment. But I decided I better just take it slow. I'm at an advanced stage, and I need to go slow so that I don't, you know, if you hurt yourself by too much at one time, then you won't do it anymore. So I'm going to try get to 10 minutes tomorrow, but we'll see. And then, of course, maintain a healthy weight. These are for just any healthy living. It's not just to prevent colon cancer. It's to prevent breast cancer. It's to prevent obesity. It's to prevent, you know, strokes. It's to prevent heart attacks and diabetes. The prevention models are the way to stop from getting sick. When we get sick, we have to have medicine, and every medicine has a side effect. Then you've got to take another medicine to overcome that side effect, and it's just a snowball effect. So if we can stay off of the medicines and stay healthy, then we're all going to be much better off. Let's see. What else we got here? Oh, I printed some of the statistics for colon cancer. I wanted to talk about them because I don't know. I don't like numbers. I don't like working with numbers, but I do like to hear the statistics. I don't want to figure them out. I just want to read them. So colorectal cancer is the 3rd most common cancer diagnosed in both men and women. The American Cancer Society estimates in 2021 there were 104,270 new cases of colon cancer, and that was that's an estimate for this year, and 45,230 new cases of rectal cancer. The rate of people being diagnosed with rectal cancer each year has dropped overall from the mid-80s because of getting screened and changing their lifestyle risk factors. From 2013 to 2017, the incident rates dropped about 1% each year. This downward trend is mostly in adults, and in older adults, an incident of among young people in the mid-90s. From 2012 to 2016, it increased every year by 2%, and in people younger than 50, and 1% in people from 50 to 64. So we just, it's all about education. It's all about people understanding the risk. It's all about people thinking, I really got to take care of myself. And some folks, they just want to make the money. They just want to, get another beach house or whatever. And maybe some people do that. I don't know. But I can tell you, I don't. I am passionate about people being healthy. I'm passionate about people taking good supplements. I'm passionate about people eating good food. I'm passionate about people moving and exercising. And anybody who comes to see me knows that, because I preach it every day to all my patients. And this kind of got all mixed up. I don't know if I can even read that. And I might be I can't read these. Let's see. I can't read these statistics. There's some mishmash on my paper. So, what's new in colorectal research? And early detection, of course. Doctors are always looking for newer, better ways. That's how the Cologuard got established, a new, better way of treating or looking for colon cancer. And at the Cologuard started out, you had to be at least age 50, and you had to get insurance permission. Now they've dropped the age to 45, and anybody can get it. Of course, your insurance will pay for it. So let's see. Then there's studies going on about certain types of diets, dietary supplements, medicines that can lower a person's risk for colorectal cancer. For example, many studies have shown that aspirin and pain relievers might help lower the risk of colon cancer, but these drugs, as we just said, have serious side effects. So researchers are now trying to figure out if the benefits might outweigh the risk for a certain group of people thought to be at high colorectal risk. So that's the early detection, and routine screening tests. And researchers are also trying to define colorectal cancer subtypes. That means grouping colorectals based on things like genetic mutations in the cancer cells, how the cells look and behave, how fast the cells are dividing, and features of the tumor itself. As been found with other cancer types, this might lead to a better understanding of disease progression and outcomes, as well as a more clearly defined treatment plan. So they're doing tests to see, to develop certain gene tests. Cologuard is one of them, a DNA. But they're looking at various genes that cause cancer and then trying to find a test that would just detect those particular genes. So we're going to take our next break, and then we're going to talk about the treatment of colorectal cancer, how we take care of it once we've got it. So don't go away, and we'll be right back with more of Here's Good Health. Hang on.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Cuss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, hey, we're back. Welcome to Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. And we are talking tonight about colorectal cancer. We've been talking about Cologuard, which is a particular kind of test that you can get that detects certain DNA if you have that DNA in your colon, which can lead to colon cancer. And now we're talking about treatment. So one treatment that they are studying is a liquid biopsy, and that's most often a sample of blood that's taken for cancer testing. It's easier to get the sample of blood than it is to get, in the tumor if you have one. And so studies have shown that liquid biopsies contain cancer cells as well as pieces of DNA from the cancer. Liquid biopsies might also be samples of urine, spinal fluid, or pleural effusion, and that's fluid around your lungs. And current research is testing colorectal cancer DNA from liquid biopsies to find specific gene mutations. The researchers are hoping to find out that if the gene changes could help doctors choose the best drugs for patients. Studies are also looking at if raising liquid biopsy tumors could predict a cancer that is no longer responding to certain drugs. So, that's something that can be done, and it may also help predict the cancer, to predict if the cancer is coming back after certain treatment. So probably the most common treatment, well, there's several most common treatments, I guess. One is surgery, and so there's a rectal surgery that can be done going through the anus without cutting the skin, and so that's always a benefit if you don't have to cut the skin. And organ preservation is something, it's keeping your body working the way that it normally does and hoping that the ideal timing of surgery and chemo used to shrink a tumor, and how to know when they've gotten the best response from each patient. Sometimes the colorectal cancer comes back, it returns, reoccurs. It can spread through the peritoneum, which is the thin lining of the abdominal cavity and the organs inside the abdomen. Most cancers are pretty hard to treat. Surgeons have been looking for, studying a procedure called hyperthermic intraperitoneal chemotherapy. Now that's a mouthful. First surgery is done to remove as much of the cancer as possible. And then while still in the operating room, the abdominal cavity is bathed in heated chemotherapy drugs. This puts the chemo right in contact with the cancer cells, and the heat is thought to help the drugs work better. Some patients are living longer with this type of treatment, but more studies are needed to know exactly what patients it can help, because one treatment might help me and it's not going to necessarily help you. Depends upon where it is, who you are, how old you are. There's all sorts of varying factors. And then there's something called a hepatic arterial infusion. And it's a surgical procedure, and a pump or a port, similar to a port for IV chemo, is implanted close to the hepatic artery. That's the artery that feeds the liver. That's the hepatic liver or hepatic artery. Doctors can put chemo into the pump and then it's released directly into the liver to kill the cancer centers while leaving the healthy liver cells unharmed. This procedure is given along with a systemic chemo, and that's like giving it in your port or in an IV, and it goes all through your entire body to help tumors in the liver shrink. And of course, there's more research being done with that. And then chemotherapy. We talked a lot about this with Dr. Manikin 2 weeks ago, and there's always new trials going on, and I don't remember him specifically saying there was colon cancer trials. I think most of them were breast, but I don't remember for sure. We probably need to watch that again and see exactly what he said. And so there's always new chemo drugs being tested for other cancers, and sometimes they'll develop a chemo for maybe breast, and it doesn't really work for breast, but it does work for colon. So, and they're always looking to combine drugs so that they work together. And they're always looking for, they're studying ways to combine the chemotherapy with radiation therapy, targeted therapies, and or immunotherapy. And they're always looking for better ways to prevent all the horrible side effects from chemo, because it kills the bad cells, but it can kill the good cells too. And so, and you lose your hair and all these kind of things. And then there's targeted therapy, and that works differently from standard chemotherapy. They affect specific parts of cancer cells and make them different from the normal cells. And targeted therapy drugs are already used to treat advanced colorectal cancer. Researchers are studying the best way to give these drugs and looking for new targeted therapy drugs. And so there's various gene mutations in the CRAS, the NRAS, the BRAF. There's the BRCA gene for breast cancer. And so they're looking for the specific mutations in these specific genes, and then they have targeted drugs that just go right into those genes and right there where the bad stuff is, and try to eliminate all the systemic problems that you have. So they've come a long way in all of this, and not just in colorectal cancer, but any cancer. So that's my little spiel on colorectal cancer. That was colon cancer screening was last month. Like I said, I was going to do this last week, but my son came, his schedule changed, and so hence my schedule changed. So we've got a few more minutes. If anybody has anything in particular they want to talk about, give me a buzz, 407-1111. Otherwise, I'll just kind of yap for the next few minutes. We're not seeing as much COVID now. Very few people are coming for testing like they did. I'm still seeing positive results, and people are still getting sick. So even though the restrictions have eased, and I'm grateful for that, but we still need to be cognizant. And if you've had your shots, that's great. And if you haven't, try get to them. Some people get pretty sick from them, though, so you have to, it's with any medicine you give. You've got to outweigh the good versus the bad. And a couple days of feeling bad is well worth it versus dying from COVID, and people are still dying from COVID. So it's a insidious disease. I hate it, but it's here, and we've just got to learn how to deal with it. We've got to learn how to treat it. We've got to learn how to live with it. I hope the masks can go away. I don't like them, but it ain't about me, as my husband is always telling me. It's not about you, Linda. So I have seen very little flu, although we have really not tested for flu. We've only tested for COVID. So, those numbers are going to be askew. They're not going to be true because we're not doing it they're just not checking. If you, in the beginning, they were counting anybody that had COVID and died as a COVID death, whether it was really from a heart attack or from cancer, or they didn't take in consideration any of the other disease process. They just called it COVID. So the numbers have never been totally true, but it's a real disease, and we've got to tackle it the best way we know how. So but I would really recommend you to get your shots. And I don't know exactly. I know the health department's giving them. Some of the pharmacies have some shots. I think they get limited amount of shots. I'm not sure how that works. We haven't gotten any at our office. I don't know if we haven't tried, if we can't, I don't know. And I know OIC has shots, and they have clinics. So try, if you can't get through to the health department, I'd call OIC and see what, when their next clinic is, and see if we can't get everybody immunized. I think it's really important that we do. So let's see. That's kind of the new thing. It's soon going to be summer, and the warm is bringing out snakes. You're going to see snake bites. It's bringing out ticks. Lady was in my office today for something else and had a tick rolling up her leg. I had to pull it off with a tweezer. So, those kind of things are happening. Lyme's disease is no joke. So please protect yourself from those ticks. If you're going out in the woods or going out somewhere, maybe even in your garden, if you live out in the country like me and have a lot of ticks. My husband's already got ticks on him. But try wear your long pants and your long sleeves. I know nobody wants to do that in the heat of the summer, but unless you're like me and have chickens and guineas that will eat some ticks. Of course, I live on a farm and I live on a lot of land, so I'm always going to have ticks. I couldn't possibly get enough birds to eat all the ticks that we have out there. But so that's coming up, and the sun, it's warm, and we just like to sit in it and enjoy its warmth, but be sure you use your sunscreen. That's still always a problem. Lots and lots of our skin cancers are from being outside, not wearing a hat, not using a high sunscreen. I use a 50 myself. So, and then now that the weather's warm, we're going to be going to the beaches and places like that too. So just take care of yourselves. There's there's a lot to do to maintain your health and to maintain health in you and in your family. So just be cognizant of that as well. And I don't know, I'm kind of out of words, which is pretty unusual for me because I'm pretty wordy for the most part. So I guess I will just say good night. It's been a pleasure to be with you, and I will see you next week with more of Here's to Your Good Health. Good night.